Good afternoon. And today we have a very special guest. I would say my neighbor, Dr. Daniel DeFeo. Good afternoon, doctor.
Good afternoon, and thank you.
And thank you very much to my audience. If you're someone who has trouble sleeping or sleep next to snoring partner, this program is going to be for you. Because we're going to talk about very unusual way of approaching your sleep and overall health from, I would say, preventative medicine. And if you're a medical professional who, just like us, trying to put puzzles of sleep and breathing disorders and other disease of our time together and find the solutions for your patients who are passionate, just like us, to find the best way of treatment, this program is going to be for you, because we're going to touch on a lot of unique topics what we didn't talk before. But first of all, I want to introduce my guest, my neighbor, Dr. DeFeo, Daniel DeFeo. He is doctor of osteopathic medicine, and I'm a high believer in osteopathic medicine, and I use it in my practice as well when I approach on a deeper level temporomandibular joint disorders, and people talk about posture or tension in the neck and shoulders. So osteopathic medicine is my way to go approach. And he is actually grew up in born in Paterson, New Jersey, and I worked in Paterson, New Jersey for good 3 years in the beginning of my career. And then he moved to Wayne, and then it's all around me, and it's very pleasant to know about that. And he did a wonderful, bachelor and medical training and complete family medicine and emergency medicine. And then he returned to New Jersey and worked in St. Joseph Hospital Department, which is also located, I would say, next door to my New Jersey office. So all of it is just very pleasant. And then he opened his osteopathic and family medicine practice in March 2022. But his approach is very unique. So please tell us, doctor, how come you start adding a lot of preventative measures or preventative treatment strategies like infusion, hormone replacement therapy, and red light to your practice? What made you do that?
Thank you. So I started my practice about 3 years ago with the idea that, patients just need time to essentially help self-diagnose themselves. A lot of patients will develop symptoms and then they'll go to their usual primary care doctor, their specialist, and they're given about maybe 5 or 10 minutes to explain everything that's going on with them. They undergo some basic tests, and then when everything comes back quote unquote normal, they get sent on their way and told that it's all in their head, or there's nothing wrong with them, or that they should see 15 other specialists to get to the bottom of it. So I started recognizing this in my early years of my practice, and I decided that there's got to be a better way than just to briefly address a couple symptoms at a time and send people away for a couple months till they come back for further testing. So when I opened my own practice, I decided to give my patients an hour for the initial consultation and a half hour for follow-ups. And I try to be as thorough as possible during that time, going through prior records, giving patients ample time to explain their symptoms, how it affects them, how it affects the people around them, and really try to do extensive testing to get to the root cause of what's causing it, rather than just rely on pharmaceuticals to treat their symptoms while the process still goes on. So I've been doing that for about 3 years now. I've gotten a pretty good word of mouth following from my patients and them referring their friends and family. And it's always great to get feedback from my patients, hearing how I've helped them after years and multiple doctors later, finally, addressing the underlying issues at hand.
I'm really pleased. I'm so sorry to interrupt you, but I want to compliment. I really like your way of approaching patients, just like I expressed in my book, what I'm writing right now, Breathless Awakening. So, in the way you describe it, I can see my patient or my hero who went to regular checkup year after year and then end up in a very tragic heart accident. Because exactly like you described, he was, either dismissed as everything is normal or just give pharmaceutical help to mask the symptoms.
Correct. And, the American healthcare system, unfortunately, is geared around repair. It's not geared around preventative care. I hate to use analogies, but it's just like, if you're driving your car and you hear a noise, you can ignore it until it's a bigger problem, or you can address it when it's early and stay ahead of the issue. With healthcare, it's a little bit different. We've almost been convinced that we need to only address things when they are wrong, or, that we only need to go to the doctor when we're sick. But if you can prevent yourself from getting sick, or prevent yourself from developing a disease that's treatable and curable, why not? Why, spend time chasing your tail and treating, problems that arise a year later, when you can stay ahead of it by staying on top of your health and making sure that you're doing the proper preventative care.
I love your approach. And I want to tell our audience, besides your bio, I want to tell how we met. We met through the mutual patient. And I really like how Dr. DeFeo found me. Dr. DeFeo has a lot of patients in his practice who have sleep apnea, and they have a CPAP machine what stand wonderfully in the closet or on a bedside table, just monitoring the decline of health. So he didn't do like a lot of medical professional or primary care physician do. It's not my job. I'm going to refer you to pulmonologist. Let's solve it. Because a patient, when they go to specialists, they don't have the same level of trust. He actually actively searched for someone who can help those patients. And he talked to a sleep study company to find somebody like me who can provide alternative solution. And I really have a very high price for such approach, for such passionate care. So if you're still not Dr. DeFeo patients, but you're willing to find somebody who really care, that's a great example. He was actively searching for the specialist who can help his patients to solve the health problem, to prevent the decline, what I so, passionately describe in my book. So I want to talk about some strategies, what you use to prevent that decline, or not only, oral appliance therapy for sleep apnea or, related to sleep, but other things. One of the symptom what men very often start looking for sleep apnea treatment would be ED, erectile dysfunction. And I would like, and the men usually come to the doctor looking for help in that department. So tell me, if somebody, come to you with that very common symptom, how do you approach the situation?
Sure. So I do see a lot of men in their 40s, 50s, 60s. I kind of joke around with a lot of my colleagues, but there's a lot of truth in it that men just don't go to the doctor from age 12 to 65. We, as children, we finish getting most of our vaccines by the time we're 12. We stop seeing the pediatrician at 18. Then we go to college, we enter the workforce. We work until we retire, A lot of my peers don't feel like they have the time to go to the doctor, or it's a lot of if it ain't broke, don't fix it type of mentality. I'm sorry if that comes along a little sexist or misogynist, but it's just an observation that I've made amongst my fellow men. So along those lines, the one thing that seems to strike men is when the equipment doesn't work. Maybe it's an issue with a new relationship. Maybe it could be like my patient this morning, who his wife came in and they addressed 2 or 3 other issues, and then kind of the old doorknob question that, hey, by the way, the wife says, I want to talk about this because it's affecting me. And it was about the patient had just developed erectile dysfunction. And, a lot of times we don't think about it as how it affects the partner, but it does.
Big time.
And the husband was very sheepish about addressing it because it's not a comfortable matter. It's a sense of pride. Sometimes it's just not a subject that sexual activity is not something a lot of people want to touch on in the first place. So I pretty much make it part of my screening process to ask about fatigue, erectile dysfunction, libido, muscle mass, if somebody works out, how their workouts compare to how they were a few years ago. That's just part of my typical intake every time I see a new patient, because there's a lot of men out there that are testosterone deficient for one reason or another. And these are the typical symptoms that one would develop when this begins. It also ties into sleep apnea because a lot of times we gain weight as we age. This leads to increased soft tissue around the neck area. This leads to more obstructive processes and sometimes can lead to sleep apnea. When you have sleep apnea, it throws off your circadian rhythm. Your hormone health is very dependent on your circadian rhythm. You were supposed to be awake when the sun is up, asleep when the sun is down, and based on that schedule, our body regulates our hormones. If you're waking up in the middle of the night because you're choking in your sleep because of the sleep apnea, your hormones are going to suffer. If you work night shifts, I see this a lot with police officers, nurses, physicians, anybody that works nights. Their schedule is backwards and their hormones suffer. And this is both men and women. So a good social history, a good sexual health history is a great way to screen for these things, because you'll pick up a lot, and it may not even be something that was the reason for the visit or on the forefront of the patient's mind. But when you ask these questions, you get a lot of responses. Oh, now that you asked, or, now that you mentioned it, yes, that's correct.
This is a beautiful story. And I would say through, in my book, I also touch the same topic because I see that topic in my practice. Not people start with that, but when you develop a trustful relationship, I would say people treat ED more like from the social cue, more like lack of interest. Female talk about that only from that standpoint, and it's a big revelation, but it's actually a physical issue. The tiredness, lack of libido, and ED, it's a physical issue. And yes, of course, it's become like a snowball, and other things become part of that, and it's very difficult to untangle. But first of all, when you visit the doctor and doctor asks the question, and then it can be beginning of a conversation, help to untangle that. So once you establish what, yes, might be sleep apnea, that we understand the treatment of sleep apnea, you already, we've mentioned, but you very careful about that, and really encourage your patients to address the disease. If you notice what circadian rhythm is off and the hormone level is not the right way, can you talk a little bit more about hormone replacement therapy? Or a lot of people don't even talk about hormone replacement, they talk about Viagra or kind of related medications.
Yeah. So it's kind of a multi-step process when this occurs. So I take into account all the information that I gathered during the history portion, and then typically we'll get blood work, and we try to do the blood work between 8 a.m. and 11 a.m. In the morning, because that's typically when our sex hormones peak. That's provided that you're on a normal daytime schedule and you're getting adequate sleep. If you're a night shift worker or you're not getting adequate sleep, a lot of times it's going to throw off your hormone levels. But for the most part, we try to time the hormones during that time. We'll get a fasting level. And not only will we check testosterone, but we'll check follicular stimulating hormone and luteinizing hormone. These are two hormones that are made in the pituitary gland in the brain. And what they do is they act on the testicles in men to produce testosterone, sperm, and other hormones. We also check some other hormones that can be affected by this system or just by other factors in their lifestyle or their body habits. Once we get that information back, I'll go over the results with the patient, and we really try to get an understanding of what's causing their hypogonadism. Is it central? Is it that their brain is just not making enough of the precursor hormones? Is it secondary hypogonadism? Is it just the testicles just aren't making sperm and testosterone anymore? Or is it something else? So typically, once we're able to get a full panel of blood work and get to the root cause, then we can go about treating it. We can, if it's secondary, we can simply do testosterone replacement. If it's primary or central, we can use medications like clomiphene that help increase production of the precursor hormones. We can even use some other medications that are somewhat off-label, but they have a beneficial side effect of increasing testosterone levels. So I can't say there's a one-size-fits-all process for patients like this. It's really tailored therapy for every single patient that comes in my door, trying to address the exact reason why they're dealing with the symptoms that they are dealing with.
So in the bottom line, you make people much happier. But now I want to talk about different area of your expertise, preventative medicine. It's very popular now, the infusion. A lot of people, they live by it. I want you to talk about NAD infusion and that Myra's cocktail. Like I want you to explain to us when you think it's time to do the infusion, who you recommend it to and.
Sure. So we'll talk about both infusions in general. So you brought up NAD first. So NAD is nicotinamide adenine dinucleotide. Essentially, it's activated vitamin B3. It is a crucial substrate for the mitochondria, right? So we all learn in 5th grade science that the mitochondria is the powerhouse of the cell. Well, this is the fuel for that powerhouse. Most of us get enough of this through our diet, but some of us either exhaust this material and we're kind of running low on it, or we just don't get enough of it in our diet. Or if anybody with a health science background, if you learned about the Krebs cycle and you know about the products that go in, the products that come out, this is one of the products of the Krebs cycle is NAD and NAD+, and that really helps fuel our metabolism. So I get a lot of patients that complain of fatigue, and even when we're doing the extensive workups, we can't really get to the bottom of the fatigue. They don't have abnormal levels of any of the underlying causes. They don't have sleep apnea. They're just tired. They're usually a good candidate for an NAD+ because generally this helps them. They feel more energetic. They feel better. They feel like they can, be more active in their lifestyle. It's also a great anti-aging product. The reason being is because, again, the mitochondria control cellular reproduction and cellular death. So once the mitochondria stop functioning, the cells tend to die off. If you can keep your mitochondria functional, you'll have more active cells. And so things like collagen and even your squamous cells that make up your skin tend to look a lot healthier because you now have better functioning mitochondria. Switching gears a little bit with the Myers cocktail. So Myers cocktail I've been using for the last 3 years or so, and it seems to be a good all-around product. I have patients that receive it because they feel it makes their skin look healthier. I have patients that take it because they also find that it helps their energy levels. I have patients that receive it because they have a viral illness and there's really no treatment for it, but it has immune boosting factors in it that help their own body recover. So in a Myers cocktail, you have multiple B vitamins. You have zinc, you have vitamin C, you have magnesium, and you have glutathione. So, the B vitamins help with energy. The ascorbic acid or vitamin C helps with immune function, as does the zinc. Magnesium is a good smooth muscle relaxant, so that's why a lot of people feel like their skin looks better along with the B vitamins. And then the glutathione replaces a lot of the liver-made glutathione. Sometimes this can be exhausted after maybe consuming too much alcohol. So it's a good hangover treatment as well. And then you're also getting fluids too. So a lot of people don't drink enough water, so it helps hydrate as well. Hydration will definitely help with the anti-aging process and the youthfulness process. So
My question, I want to ask a question from my audience. What would be the financial involvement with those infusion? How much is it?
So how much is it? So if somebody were to come to my office, the cash price would be $225 for the Myers cocktail and $300 for the NAD. I will say we've had pretty good success with getting insurance coverage because we determine medical necessity. So most of my patients, I've been able to get it covered by their insurance, which is beneficial for everybody. So the patient doesn't have to pay for anything else out of pocket and they leave feeling better. So
that's a fantastic thing, because me as a doctor who help people with sleep apnea, very often I can address the event, but people say, I'm still tired. Mm-hmm. So now I have go-to place. If you're still tired, that might be, of course, tiredness is not one size. It's multiple factors, but that can be one of the solutions, and they might find. So my last question to you about red light therapy. I'm a big proponent of the red light. I find it beneficial, but I want to know for you, from your patient standpoint, what's the reasons you prescribe red light therapy? Why is it so good, and how it happened in your office?
Sure. So when I first opened my office, I was getting a lot of questions about Botox. Well, I shouldn't use brand names. So botulism toxin for youthfulness, right? I personally have never administered it, and I was a little uncomfortable with it. And I was doing a training course, and I stumbled upon a vendor at a conference who was selling red light devices and low-level laser devices, and that's essentially what they are. These devices emit light in the red spectrum, and that spectrum of light penetrates the skin to a certain depth. And the depth that it penetrates the skin is the depth that helps renew collagen and also helps activate the mitochondria, very similar to the NAD+, just in a different fashion. The device I ended up purchasing also emits other different spectrums of light. It emits blue, it emits yellow, it emits green, and ultraviolet. And these are, depending on the wavelength, are used for many different conditions. So I've used this device to treat wounds. I've used this device to treat eczema, acne, pain. So red light's a great pain device. I'm seeing a lot more of these red light saunas pop up, and these red places where you can lay in a red light bed. It's not just for anti-aging; it can help with pain as well. But there's multiple different uses for these light wavelengths, depending on what the condition is that we're addressing.
Thank you very much, Doc. It was such a pleasure. I learned a lot, and I'm looking forward for our collaboration. I think it's so wonderful when medical doctor and dentist can collaborate. We can really help a lot of people. So thank you very much for sharing your information. And you can find Dr. DeFeo. We're going to put the links underneath this interview, and find all the benefits his office and his approach can provide you and improve your health. So thank you.
Thank you very much for having me, and thank you to your audience.
And stay with us on the channel, and you can find a lot of information like Dr. DeFeo shared with us.